Hi, a very good afternoon to you, good evening to you. Today I'm going to speak to you about hair transplantation, or what is commonly referred to as hair restoration. Now, when I started doing hair transplants a long time ago, and I was one of the first people to start doing hair transplants in Mumbai when I returned from the US in 2002, 2003. A lot has changed since then. Hair transplantation is the fusion of art and science. I can train a monkey to do hair transplants, but the monkey won't know how to plant the hairline, what to do, what not to do. So if I was to just go ahead and tell you the reasons why I have actually moved away from hair transplantation, I personally don't do any of them anymore. But my practice with Dr. James, Dr. Wamshi, continue to do hair transplantation. And I tell you why I stopped doing it. From being such a beautifully executed hair restoration surgery, there was a paradigm shift to making this very trivial. All kinds of people jumped in, including technicians. So I couldn't compete or use my skills to kind of face this kind of work from other non-doctors with numbers going down as 30 and 40,000. Please keep in mind that when that happens, Indians always start lowering prices. Very soon, you'll have to pay patients to get them in and do their transplantations for free. Does that make sense to you? What also doesn't make sense is to go to other countries like Turkey or here or there. There's nothing fancy about going other places. When something goes wrong, it is the doctors here that are going to help you out. And by the way, we have some very, very fine surgeons, including the surgeons at our place, that do a very, very nice job. Make it in India, and make it, something where you won't regret because you're not able to run out there and get something fixed. Now, let's go to the slide now and show you what a modern hair transplant should look like. This is what it should look like. And unfortunately, when you start looking at assessing a patient who has no hair, the things that should come into mind is the following. First of all, where is the hair loss? Is it frontal, temporal? If it's frontal or temporal, then you must consider doing hair transplantation because that's the only way it's going to be back. If you have hair loss at the crown of the head, or what is known as male pattern baldness, then most often they should be done with medications, PRP. There are non-medical ways or non-surgical ways to take care or recruit the hair back. Miniaturization of the hair can be somewhat restored by putting them on some supplements with or without fin fascia, which is generally what we do. PRP seems like a good idea with growth factors for only once a month and for only 6 months. That's our regime of doing hair transplantation and hair restoration. Now, when I started doing hair transplantation, it was FUT. So with FUT, this is how it is done. And you can get a very, very nice result with lots of grafts. And today with this trichophytic closures, it's barely visible. However, we have to keep up with times. So what is the modern times? The modern times is follicular unit extraction, wherein these are punched out, either with a rotary instrument or with hand punches. You can take the hair up and graft, or rather extract the hair from here. Now moving on to going forward, this is a terrible thing. And one of the things that goes wrong with selection of the patient is, keep in mind that the age of the patient is extremely important when planning somebody's hair restoration surgery. Somebody in their 20s, somebody in their 30s, somebody in their 40s, somebody in their 50s, 60s or 70s. Now, everybody is aspirational. Everyone probably wants their hair to stick around till the day they die. However, maybe in some patients, for whatever reason, genetics, high DHT, or whatever else, you start thinning hair or losing hair. People are competing with each other to go with numbers. I did 3,000, I did 4,000, I did 5,000. The other day I saw somebody's posting 7,800 grafts. That's madness in a 20-plus-year-old kid. What you're going to end up with is this is what is going to happen. This is pre-op and that is post-op. How does that look to you? What you don't keep in mind, or what most people are not keeping count of hair follicles. There are a fixed number of hair follicles. A few years back, some bright guy came out and started saying that he could split hair follicles into two and use them as two grafts. It was a hoax. The person is no longer practicing. And then the same person started giving guarantees on stamp paper, all of which is unethical and absolutely should not be practiced by anybody with a medical degree. So now what will happen is, you see what this has done. If you took 7,800 hair, harvested them and put on somebody's head, by the time they're 30, they're finished. They would have to look for you with a gun in their hand to get you. Because what you have done, meaning people out there, have done is over-grafted or over-extracted, to be exact. So the age of the patient becomes very important. 20s, 30s, 40s. Now, in my hands or in my practice, we go by age. Age has a lot to do with how we select the number of grafts and the number of grafts we transplant. We almost never go more than 1,500 to 2,000 hair transplants or hair grafts at a time. Why? Because it gives you enough time afterwards and a few months later, whether to do more grafts or see what kind of outcome you've gotten. Don't you want to try something out when you give a new drug? Don't you do a skin test? You do a small test dose? If you're using a cream, don't you apply it on your forearm to see if you have no reactions from it? If you buy a fish tank, most people will tell you, you put water, you make the temperatures all right, and put one or two fish at a time. Why? You want to see the survivability of the fish. And also you want to have some sort of a neutral position before you put many more fish in there. So putting a lot of fish at the same time can kill everything. The same way, you can't do too many hair transplants at a time. It's a bad idea. Now, FUT, this is how it is done. A strip is taken out and they're sectioned out nicely. FUE is you punch them out, as you can see, follicular unit extraction. And going forward, FUT, you get a nice graft like this. You see, you got 4 follicles here, you got 3 follicles here. This is FUE done manually with a punch. You can certainly use a rotary instrument. The rate of transection would be less if you use the hand punch. But whatever skills you have, you can use them. Now, FUE, if it's done properly, should look something like this, not like punched out look. And an FUT would have a scar like this if you keep your hair short. So this is basically the difference between the two types of grafts. Now, outcome of a hair transplantation, this is the way it should be. It's very well done, okay? This makes sense. This is a believable story. And this is hopefully what all of the hair transplants should look like. When I speak to you today and I stand before you, I want everybody that's listening, whether it be doctors or just lay people, to use your thinking caps and participate with the doctor performing this procedure as to what are your long-term goals. Take into account the number of hair present, take into account the thickness of the hair, take into account your age, and moving forward, I hope you pick the most important decision you will ever be making is the choice of the surgeon. Now, according to a survey done 2 years ago by the aesthetic surgeons, plastic surgeons, and the cosmetic surgery, dermatologists, all the different kind of societies, and we found that majority of people were unhappy because they chose their surgeon based on fees. 85.7% were unhappy. For further information, please write to, it's on the board here on the TV screen, write to or call me, and I hope that you have taken home some message. The message is be careful, participate in your treatment. Thanks for watching.